Hello, my name is Gina Denny-Champion. I'm the Executive Director for the Wisconsin Nurses Association, and I'm so glad you're interested in learning more about the APRN Modernization Act and how you can prepare for the public hearings that are coming up next week. So welcome. Yes, we finally have public hearings. It's been a long time since we've wanted this as a group over the years that have worked really hard on getting our legislation to this point. We have two bills which are called companion bills in a Senate Bill 394 and Assembly Bill 396. So what we have in terms of for next week, Senate Bill 394 will be heard in the Senate Health Committee. The public hearing is scheduled for next Wednesday, July 28th, beginning at 10 o'clock. And the location of the hearing room will be hearing room 201 Southeast. In terms of the Assembly Health Committee, that public hearing is scheduled for the next day, Thursday, July 29th. That public hearing will take place in room 412 East. The time for the hearings is from 9 until 5. There will be a total of 11 bills scheduled for the hearing that day. So far on the listing, AB 396 or the APRN Modernization Act is listed as the last of the hearings. So just a quick overview of what this bill does. It provides a separate license for APRNs. It addresses the four roles. It allows APRNs currently practicing in a recognized role to receive an APRN license. It replaces the term right now, APNP or Advanced Practice Nurse Prescriber, which is in at least 50 other state statutes. All of those are being replaced with APRN. Excuse me. We also are repealing the Nurse Midwife Practice Act, which is 44115, and also the section of the statute's prescription privileges for advanced practice nurses, 44116. The criteria for licensure will be that you graduated from an accredited APRN education program, that you graduated with a master's degree or higher in one of the four roles. It also allows that you have a postmaster's certificate in one of the four roles, that you hold national board certification that is approved by the Board of Nursing, and that you have evidence of having medical malpractice insurance coverage. In addition, it includes a description of the scope of practice for each role. It clarifies a practice standard, which we all do, is that when we run into a patient care situation that is beyond our expertise, that we will consult, collaborate, or refer the patient to another healthcare provider. We know that this is what we do, but this is the one way of being able to show this is what we do. And we will accept the responsibility and the accountability for doing that. It allows for the delegation of task or order to another clinically trained healthcare worker, and that includes the registered nurse. It requires 16 hours of continuing education in clinical pharmacology or therapeutics. I want to share why it is important that we be at the public hearings, or at least try and let our legislators know why we are supportive. When we look at who's registering in support. We have schools of nursing. We have our four nursing associations. We have four insurance companies who really understand the importance and what we bring and the safety and the value that we have, and also AARP. Registry and opposition are all physician associations. And what are they saying? Why are they opposed? The biggest piece is safety. So we have to be able to share information about our safety that we are safe. There's also concerns about, in one of the scope of practice definitions, the word diagnosis is used. And the question is, since when can we start diagnosing? And of course, we know how else have employers of APRNs been getting reimbursed. It's through a diagnosis and a CPT code. There's also, what's going around is that there is no evidence showing that that we're safe, that we're effective, and that we're good providers. We will be countering that one with lots and lots of reports of studies. We'll be putting some of those studies, the references on our website, so that you can also use those if you want to provide testimony. But we will be having that information available. So the public hearing, sort of why, what is the purpose? It is about educating and informing the health committee members. And in this case, it's about our bill. We want to persuade the committee members to support our bill. Why is this important? It increases patient access to care. That can actually take place within the legislator and where you live, in their legislative districts and their communities. We are conforming with 23 other states that have adopted this legislation that allows for APRNs to practice the top of our license. It supports public protection. We know that with the Board of Nursing, why boards are created. One of the legs of the three-legged stool is to protect the public. So in this case, by creating a separate licensure, we are acknowledging, and the board is acknowledging, that we do have advanced clinical skills, education, and practice abilities that are beyond that of the registered nurse, and why we want the APRN license to demonstrate that. And with that comes our accountability and responsibility of the care we provide to the public. Yes, indeed, we're going to be held at a higher standard. If you know in your employment setting, if physicians are being paid to be your collaborator, that by removing or by not requiring collaboration in the state statutes, that it will certainly decrease costs for the organization. I wouldn't use this unless you can really prove it and be able to speak to that. Okay. So let's talk about the process. The way it works is, so the legislative bills were introduced and have been assigned to the health committees. The committee chair, in this case, the chair of the Assembly Health Committee is Joe Sanfilippo, and the chair of the Senate Health Committee is Patrick Teston. So it's up to them to decide if they want to hold a public hearing, and indeed they do, and they're scheduled, like I said, for next week, July 28th and 29th. They then notified members of the committee, as well as the public, that there will be a hearing, public hearing, and they list all the bills that are going to be heard that day. They then, the actual day of the public hearing, this is where we're hoping that you can join us, is that when you get to the hearing room, outside the hearing room, there will be pieces of paper that you will need to fill out. And what you're filling out on that particular form is your name, the address, the bill numbers that you're registering either in support or opposition or for information. You will then be checking a box saying, I'm going to be speaking in favor, opposition, or information, or that you're submitting written testimony, but you are not planning on speaking. Or lastly, you're not submitting anything, so you're just there, and that you're registering in support, opposition, or information. This form will be given to what they call the legislative page, the person that one of the guys, you'll see them, they dress in a blue jacket with a state symbol on their pocket. So when the hearing starts, the committee chairs welcomes the committee members, as well as all of us sitting and observing. They will also talk about any rules for the day. And as I was thinking, as we're talking about the assembly with all those bills and trying to get finished by 5 o'clock, that the chair may really want to restrict the amount of time to provide testimony. So first, in terms of when our bill comes up, they will ask the bill sponsors to come forward and describe the purpose and intent of the legislation. So again, it will be Senator Patrick Teston and Representative Rachel Cabral Guevara, who is from the Appleton area. Is also an NP that owns her own business. So they'll provide their legislation. Following that, the committee members will be asked questions. We'll be asking questions of the bill sponsors. And this whole process may take anywhere from 45 minutes to an hour. Then the remainder of the hearing, if we're planning on providing testimony, then we will be called upon. And literally, you will need to get up and go to the area of the hearing room where the microphones are, so that you can be recorded. So you will come forward and present, and typically the chairs will call on the individuals based on, it's kind of like pro and con or favor or oppose. So we won't, so that they'll start with, who's in favor, who's in opposition, and then there are some folks that just testify for information only. Also, when you're finished delivering your testimony, there may be questions again from the committee chairs. Some strategies, if you're going to be presenting, have your testimony prepared, have it in writing with copy for each of the committee members. So minimal amount of 16 for the assembly, 5 for the Senate. Don't forget your own. I find if some people, typically with me, if I'm going to be delivering testimony, mine will be double spaced and probably in a larger font, so I don't lose my place. If you're going to be providing testimony, practice. And also, as you're delivering, think about that you're talking to one of your patients. We do have members on that health committee that are nurses, but the other 12 are not. So remember, avoid jargon and just really try and speak to them as if it was one of your patients. It's easier that way. Also, the other important strategy is listen to what the other speakers are saying. If the speakers before you have addressed your talking points, don't read your testimony. Rather, you can just say that, I agreed with the previous speakers in terms of what they're saying about the role of NPs. You can, though, share information about your practice and kind of what it means to what you're doing and for the benefit of your community. That's very important. What you can also do is, as you're listening, and let's say it's the opposition, and they're talking about that we're not safe, we can you can just talk about the evidence that supports, the contrary. And we will have, like I said, that information available. We will help you with just kind of adding or some talking points for you, so that when you get up, it's more important to talk about why you don't agree with those other speakers that are saying those things, that we have all sorts of safety information, and that sort of what your patient satisfaction scores are, and those sorts of pieces. So that's a big strategy. Getting ready, trying to give your testimony. I know it can be, nerve-wracking, but it'll be important to be able to refute what those other speakers are saying. So again, the committee members will, ask some questions. Think about what they're asking, and then state what you know. If you're unsure, say it. I'm not sure, but I'm willing to get you that information, and we will make sure that that information is available. Or, another speaker may be able to come up and provide that information that you weren't able to answer. And it's okay if you don't know, just don't make it up. So part of the strategy is WNA would really like to know if you are a constituent of any of the committee members. They are the ones that are going to be listening, and if you're their constituent, they're going to listen closer, okay? So that's, again, where you talk about what you're doing to, as what you bring, what APRNs bring to the communities and the folks in their districts. You might want to let them know ahead of time that, hey, I'm coming to present or speak at the hearing. Looking forward to, seeing you. Or if you want to send a note that day to the committee member, we can make sure that and this is given to the page, and that page should be a capital P page. That's that legislative person that's wearing the blue jacket could also get that note to them. Sometimes that legislator want to, come, from where they're sitting and maybe find you and just have a nice conversation with you. Obviously, we want to dress in a professional manner. Masks are optional. They're not mandated or required in the Capitol. If we think about the assembly hearing and all those different bills, there are going to be a lot of people coming and going, listening to, that are going to want their turn to speak. So if you're not comfortable with the crowds, feel free to bring a mask. WNA will bring some as well. You may also want to bring some water for yourself to drink. Just keep yourself hydrated. I don't know if the water coolers are on at this point in time, so I would make sure you're taking care of at least your hydration needs. Again, when you're filling out that public hearing, that form, again, if you're not speaking, but you have written testimony, you can give that testimony to, the legislative page with your registration form. And that you're checking the box, you are in favor of the legislation, but not speaking. Okay, so that's more things to think about. So who are the members of the Health Committee? The Senate, it's Teston, who is chair and sponsor, so he'll control the agenda of the day. And these are the other senators. Check and see if one of them are yours, and if you could let me know, that would be great. And then the members of the Assembly Committee, 16 of them. Those that are in a gray, Representative Gay Magnifici is a retired nurse. Representative Donna Rosar is new to the Assembly. She is a registered nurse. Representative Cabral Guevara, our Assembly sponsor, bill sponsor, is also a registered nurse NP. And we have Representative Sarah Rodriguez, who is also a member of the Health Committee. So we're pretty fortunate to have 4 nurses in the legislature right now. And I think they have all signed on in support as a co-sponsor of our bill. So let's talk about your letter or your testimony that you're either going to either say or have it in a letter format that you can give to the representatives or to the committee when you get ready to speak. So, it's a typical letter. You have the date. You'll have Senator Patrick Teston, chair of the Senate Health Committee. That's his address. And again, just turn that in and it will get to him. For the Assembly, again, that date will be July 29th. And it will be Representative Joe Sanfilippo, chair, Assembly Committee on Health, room 314 North. and the state capitol. So those are their actual the rooms that they're off. These are their office numbers. Then the next piece in terms of your letter regarding supporting SB 394 and AB 396 APRN. Dear Chairperson Teston and members of the Senate Health Committee, and the same thing with San Filippo and members of the Assembly Health. And then beginning the content of your first paragraph is, your name, where you live, and that you practice in, as an NP or CNS, or that you're enrolled in an NP CNS education program, or you're a registered nurse. And then I thank you for holding a hearing on the 2 companion bills. We are both the same, and I'm speaking in support of this legislation. Then you begin to talk about why you support the bill, what it means to your patients, what does your practice look like today, and how collaboration is an unnecessary, burden. You can also talk about wanting to be able to practice at the top of your license, which can increase access to care, efficiencies, transparency, more reimbursement for your employer, or savings for your employer. And then any other information you would like to share. Then for your closing, thank you again, Chairperson Teston or San Filippo, and committee members for providing me the opportunity to provide my thoughts. I respectfully ask that you support this legislation and vote it out of committee in the near future, which I'll talk about voting out of committee in the next slide. And then to please let me know if you have any questions. Sincerely, your name, your credentials, your home address, and include your phone number. Legislative aides, when they're trying to contact you in this sort of period of time and they have questions, they find the phone number is very helpful to them if they're trying to contact you. So as we get again back to the sort of the public hearing process and post-hearing, like we said, in assembly, time may be limited to 3 minutes. Because it is going to be a very long day in the assembly, committee members will probably come and go. Sometimes they'll have other meetings they have to get to, but their staffers will remain and listen to the conversation. We also have an organization called Wisconsin Eye that will probably provide live coverage and will be recording the testimony and the conversations. So following that hearing, when it's adjourned, the committee chair then reviews all of the testimony that has been submitted, and they will meet with the bill sponsors to discuss any proposed amendments. So as they're listening, they might be, listening to what is being supported, and that yes, this additional information or language would be helpful and clearer. They can also, if what they're hearing, strike, make a motion to get rid of some of that language. It's at this point in time that we find out what amendments are going to be being added or proposed, and which ones are being, what language might be struck. We may be contacting you to contact your legislators of this committee to let them know whether we support or oppose those amendments. So that could be another real important time to contact your legislators. Then oftentimes in the next committee hearing, and if not the next, the chair can make a decision to bring the language or a particular bill back, look and discuss about the amendments, ask for the committee to vote on the amendments, and then they'll vote on the whole package. And what that is called is there is executive session where it's a final vote to leave the committee and then move over to their full House, either the full Senate or the full Assembly, to take on a vote. So if you cannot attend the public hearing, please contact your legislators via email, letter, or phone message. we have a messaging platform that's on the WNA website. It's called Nurses Voice, and that you can go there, and there is a sample message that all you need to do is add who you are, what type of healthcare provider you are, and anything else you want to add to it, and then you can send it. It will know your legislators because you put in where you live, and if you're in our system, then it will automatically send it to your legislators. So feel free to use that. If you would like to send a formal letter, put that in the body of the email to the legislators, and again, your name and your phone number. If you can, please ask your nurse colleagues to kind of, we don't want to call it get out the vote, but let's get our voice. This is our the best opportunity we've had with this piece of legislation to really get it over the finish line this session. So if any of your colleagues need assistance, you could take them to the website, WNA website, or any other things, and to just really just spend a couple minutes sending their email. It is very, very important. So with this, if you have any questions, you can send them to Bree at Wisconsin Nurses Organization, nurses.org, and she will get those messages to me as well, and then I will share them with our other 3 lobbyists. So I want to, in advance, thank you for your time. I appreciate it. You can let me know if you're planning on giving any testimony, or do you know who, if you know who your legislators are and they're part of those committee members, if you could let me know, and we can help maybe do a special outreach to those folks as well with our assistance. So thank you, and I hope you have a good day, and look forward to hearing from you or seeing you next week.